Hey everyone, and welcome back for another deep dive. Today we are going to take a closer look at diabetes in pets. I think this deep dive will give you a new perspective on this disease.
It's wild how common diabetes is in pets these days. And, it's more important than ever for owners to understand what's going on.
I totally agree with you. So let's start from the beginning. What exactly is diabetes?
Okay, so imagine your pet's body is like a car, right? And glucose is the fuel. With diabetes, the problem is that their body has trouble using that fuel efficiently. And that can lead to a whole bunch of problems down the line. The actual medical term for this is diabetes mellitus.
Diabetes mellitus, got it. So is it always an issue with insulin? Or are there other things going on?
Well, insulin is definitely a big part of it. It's like a key that unlocks the cells and lets the glucose in to provide energy. When there's not enough insulin, or the body can't use it properly, glucose builds up in the blood. And that's when we start to see problems.
So the fuel can't get into the engine and the car can't run properly. How often does this engine trouble happen?
Well, it's actually more common than you might think. Around 1 in 300 dogs and cats develop diabetes at some point in their lives.
Wow, that many. So what actually causes this insulin disruption in the first place?
In a lot of cases, it comes down to damage to these tiny little things called islet cells in the pancreas. They're responsible for producing insulin.
So the insulin factory is broken. How does that happen?
There are a few things that can cause it. Sometimes the body's immune system attacks its own islet cells. That's what we call an autoimmune response. Other times it's a side effect of another condition, like in dogs, for example. Severe pancreatitis can damage those insulin-producing cells. And with cats, it's often this thing called amyloidosis.
Amyloidosis, what is that?
It's when this abnormal protein called amyloid builds up in the organs, and it can happen in different places, including the pancreas. So these amyloid proteins basically mess up the normal function of the pancreas, including insulin production.
So it's like these rogue proteins are messing everything up and the pancreas can't do its job.
Yeah, exactly. And it's really common in cats, which might explain why they tend to get diabetes more often.
So there isn't always just one cause, right? There can be a bunch of different things happening at the same time.
Yeah, for sure. Like, think about hormones. Hormonal imbalances can also cause problems, like hyperglycemia or Cushing's disease can lead to insulin resistance and eventually diabetes.
Right, Cushing's disease, that's where the adrenal glands produce too much cortisol, right?
Exactly. And that extra cortisol messes with how the body uses insulin, which sets the stage for diabetes.
It's like a chain reaction of problems.
Pretty much. And of course, we can't forget about genetics. Some breeds are just more prone to diabetes than others.
Right, like some breeds are more likely to get hip dysplasia or certain types of cancer. I guess genetics can make them more likely to develop diabetes too.
Yeah, exactly. So like miniature poodles, dachshunds, schnauzers, and beagles tend to be more susceptible. And in cats, you see it a lot in Burmese, Russian blues, Norwegian forest cats, Abyssinians, and Tonkinese.
So if you've got one of those breeds, you need to be extra careful.
Right, definitely. Catching it early can make a big difference. You can manage it better and prevent complications later on.
That's super important.
Yeah.
And speaking of catching it early, what are some warning signs that might suggest a pet is developing diabetes?
The classic signs are increased thirst and urination. We call that polydipsia and polyuria. You might also notice changes in their appetite. Sometimes they'll eat more, sometimes less, and they might gain or lose weight.
So if your dog is suddenly drinking tons of water, or your cat is always using the litter box, that could be a bad sign.
Exactly. And the appetite changes can be a little tricky because it can go either way. Actually, believe it or not, up to 50% of cats with diabetes actually eat less.
Really?
Yeah.
I would have thought they would be starving all the time if their body isn't using glucose properly.
It is strange, but those changes in appetite, no matter if they're eating more or less, are something to watch out for.
It's like their body's trying to tell you something's wrong.
Yeah.
What else should owners look out for?
Well, they might be weak and tired, like they don't have as much energy. And sometimes dogs can develop cataracts from diabetes.
Cataracts? That's serious, isn't it? Does it mean their vision will get worse?
It can, yeah. Cataracts make the lens of the eye cloudy. Older dogs can get them naturally, but they tend to develop faster and more severely in dogs with diabetes.
So if you notice your pet bumping into things, you should probably get them checked out. It sounds like catching these signs early is really important.
It really is. The earlier, the better. It gives you a much better chance of managing the condition and avoiding those more serious problems down the line.
Before we move on, I just want to say to everyone listening, if you notice any of these signs in your pet, don't freak out, but don't wait to take them to the vet either. Early detection is key.
Couldn't agree more. It's better to be safe than sorry.
Okay, so let's talk about some of the things that can go wrong. What are some of the health risks for pets with diabetes?
Well, one of the biggest problems is that diabetes can weaken their immune system, which makes them more susceptible to infections, like urinary tract infections. Cystitis and prostatitis are common. And, skin problems can happen more often too.
So their body can't fight off infections as well. Are there any particular infections that are really bad?
There's this rare one called emphysematous cystitis that we see sometimes. It's caused by bacteria that infect the bladder and make gas. It's not common, thankfully,
Yeah,
but it's definitely something we keep an eye out for.
that sounds scary. So infections are a big concern. What else is there?
Fatty liver disease or hepatic lipidosis is another one we see, especially in cats. Basically, fat builds up in the liver and messes with how it works.
So diabetes can also affect their liver.
Yeah, it's all connected to the way their bodies use fat because of the lack of insulin.
It's crazy how one problem can cause so many other problems.
Totally. And then there's diabetic ketoacidosis or DKA. That's a really serious complication, and it can be life-threatening if it's not managed properly.
DKA. I've heard of that in humans with diabetes. What's actually happening in their bodies when they go into DKA?
Well, it's pretty similar in pets. Because their body can't use glucose for energy, it starts breaking down fat instead. And this process creates these things called ketones, which are acidic.
So it's like their body's running on a backup generator, but the generator's giving off harmful fumes.
Great analogy. And these ketones build up in the blood, and that causes metabolic acidosis, which can be really dangerous, even fatal.
It sounds really serious. So catching it early and managing it properly is super important.
Absolutely. Regular vet checkups, keeping an eye on blood sugar, and sticking to the treatment plan are essential.
Makes sense. How do vets figure out if a pet has diabetes? Is it a simple blood test?
We do blood and urine tests. We're looking for high blood sugar, that's hyperglycemia. And we also look for sugar in the urine, which is called glycosuria.
So you need to do both tests to get the full picture.
Right. And here's something interesting, especially for cat owners. Stress can actually raise blood sugar levels temporarily in cats.
So just because their blood sugar is high once doesn't mean they have diabetes.
Exactly. We might recommend doing multiple tests over time to be sure. There's also this test called a fructosamine test. It's really helpful for telling the difference between stress-induced high blood sugar and actual diabetes in cats. It shows their average blood sugar over a longer period, so it gives us a more accurate reading.
So it's not always a clear-cut diagnosis.
Right. And once diabetes is confirmed, we come up with a treatment plan that's specific to that pet's needs.
This is where it gets really interesting for pet owners. What happens when their pet is diagnosed with diabetes? What are their options?
Well, the most important thing is that managing diabetes is a team effort. It's the vet, the owner, and of course the pet.
So everyone needs to work together.
Exactly. And for a lot of pets, the main treatment is insulin therapy.
So just like humans with diabetes, they need insulin injections.
Often, yes. But it's not a one-size-fits-all approach. The type of insulin, the dosage, how often they need injections, it all depends on the pet and how they respond to treatment.
So things like their size and how bad their diabetes is will affect the insulin they need.
Yeah, we consider a lot of factors when we create their insulin plan. And a lot of times we recommend that owners monitor their blood sugar at home. That way we can make sure the dosage is right and adjust it if we need to.
That makes sense. And I know there are different types of insulin.
Yeah, so one type that's really promising, especially for cats, is called basal insulin. It's designed to release insulin slowly and steadily over time, kind of like how a healthy pancreas would.
So it's a more natural way to give insulin.
Exactly. And studies have shown that cats treated with basal insulin, along with a low carbohydrate diet, can actually go into remission, sometimes even up to 90% of the time.
Wait, remission? You mean that they might not need insulin anymore?
That's right. It's pretty amazing. Cats seem to respond really well to basal insulin and a low-carb diet.
That's great news for cat owners. What about dogs? Do they have the same kind of success with basal insulin?
Not really. While some dogs do see improvement, diabetes in dogs is usually a lifelong condition, unless it's caused by something else that can be reversed.
So for dogs, it's more about managing the condition and preventing complications.
Yeah, but that doesn't mean there's no hope. With the right care, dogs with diabetes can still live long, healthy lives.
Absolutely. So you mentioned basal insulin for cats. Are there other types of insulin used for pets?
There are. We use things like NPH, Lente, and PZI, but they don't have the same high remission rates as basal insulin in cats.
So basal insulin seems to be the best option for cats. Are there any other treatments besides insulin that owners should know about?
There are some alternative treatments, like oral hypoglycemic agents. There are medications that either help the pancreas make more insulin or make the body more sensitive to the insulin that's already there, but they're not usually as effective as insulin, and we usually only use them in specific cases or alongside insulin.
So insulin is still the main treatment for diabetes in pets.
For the most part, yeah. And it's really important to remember that DKA is a medical emergency. You need to see a vet immediately.
Definitely. If a pet starts showing signs of DKA, like being really tired, vomiting, dehydrated, or having trouble breathing, you need to get them to the vet right away.
Absolutely. Time is really important in those situations.
Well, this has been a really informative look at diabetes in pets. We've talked about what it is, what causes it, the warning signs, and the different treatments.
Yeah, and I hope everyone listening feels like they have a better understanding of this condition and how to manage it if their pet ever develops it.
Exactly. Knowledge is power. Knowing what to look for and what to do can make a huge difference for your pet's health.
Absolutely. And don't forget those regular vet checkups. Catching it early is key.
We've still got a lot more to cover, so make sure you tune in for part 2 of our deep dive into diabetes in pets. We'll be talking more about managing the condition, including diet and exercise.
We'll also be talking about home monitoring for blood sugar and the emotional side of caring for a diabetic pet.
So don't go anywhere. Welcome back to our deep dive on diabetes in pets. So before the break, we were talking about how DKA is a serious medical emergency.
It really is. It's so important to manage diabetes properly. And if you see any signs of DKA, get your pet to the vet as soon as possible.
Absolutely. So let's shift gears a bit and talk about what it's actually like to live with a diabetic pet. What are some things owners can do to manage it day to day?
Well, routine is a big one. Just like with humans, pets with diabetes do best with a consistent schedule.
Makes sense.
So that means regular meal times, insulin injections at the same time each day, and even scheduled exercise.
So it's all about creating a stable environment for them. Speaking of routine, I imagine diet is a big part of this. How much does what they eat affect their diabetes?
It's huge. Diet is one of the most important things for managing diabetes. It's all about finding the right balance to help regulate their blood sugar and keep them at a healthy weight.
So what does a diabetes-friendly diet look like for a pet?
Well, for dogs, we usually recommend a diet that's higher in fiber and complex carbohydrates.
The carbs are okay.
It's about the type of carbs. Complex carbs take longer to break down, so they don't cause those rapid spikes in blood sugar.
So no sugar rushes.
Exactly. And we also want to limit fat intake, because being overweight can make insulin resistance worse.
Right. It's all about helping their body use insulin as effectively as possible.
Yeah.
What about cats? Are there special diets for them?
Cats are a little different as always. Remember how we talked about cats going into remission with basal insulin? Well, diet plays a big role in that. We often recommend a low-carbohydrate, high-protein diet for cats with diabetes.
So changing their diet can actually help reverse their diabetes.
It's not guaranteed, but it can definitely increase the chances. Basically, by reducing carbs and increasing protein, you're helping their body regulate blood sugar better. There are even special diabetic cat foods that have shown great results.
That's amazing. So it's not just about managing the symptoms, it's about potentially reversing the condition. What about exercise? Can that help with diabetes too?
Oh, definitely. Exercise helps improve their insulin sensitivity, meaning their body can use insulin more effectively.
So exercise helps the insulin do its job better.
Exactly.
What kind of exercise are we talking about here?
Pretty much anything that gets them moving. Walks for dogs, playtime for cats. Even moderate exercise can make a difference.
I'm sure you'd always recommend checking with your vet first, though.
Yeah, of course. They can help you figure out what's best for your pet.
So we've talked about diet and exercise. Now let's talk about home monitoring. You mentioned earlier that owners can check their pet's blood sugar at home. How does that work?
It's pretty similar to what humans with diabetes do. You use a glucometer to measure their blood glucose levels throughout the day.
And how do you get a blood sample from a pet?
Usually we take a small drop of blood from their ear flap, and then you put that on a test strip that goes into the glucometer.
I imagine it takes some practice to get the hang of that.
It does, but most owners get used to it pretty quickly, and your vet can show you how to do it properly.
It sounds like a really helpful way to track how your pet is responding to treatment.
It is. By monitoring their blood sugar at home, you can see how their levels change throughout the day. And that can help you and your vet make decisions about their insulin dosage or diet.
So it really gives owners more control over managing their pet's diabetes.
Exactly.
It's all about being a team.
Now, it's important to talk about the emotional side of things, too. Taking care of a pet with diabetes can be tough.
It is a big responsibility,
Ah.
and I'm sure it can be really stressful.
Absolutely. It's a huge adjustment. And it's normal to feel all sorts of things: worry, anxiety, maybe even some guilt. It's important to know that you're not alone.
Are there any resources or support systems for owners who are going through this?
Definitely. There are support groups, online forums, websites with tons of information. They can help you connect with other people who understand what you're going through. And don't forget about your vet. They can offer support and guidance too.
Right. It's a team effort.
And remember, even though diabetes is a serious condition, it doesn't have to define your pet's life. With the right care, they can still live happy, healthy lives.
I think that's really important to remember. It's not a death sentence.
Right. And the more you understand about this condition, the better you'll be able to take care of your pet.
This has been a really insightful look at what it's like to live with a diabetic pet.
Mm.
We've talked about managing their condition day to day, the importance of diet and exercise, and the emotional aspects of caring for a diabetic pet.
Yeah, we've covered a lot of ground.
But there's still more to come. Make sure you stick around for part 3 of our deep dive. We'll be talking about some of the exciting advancements in diabetes research, and we'll explore some potential future therapies, so don't go anywhere.
And we're back for the final part of our deep dive into diabetes in pets. We've talked about the challenges of this disease and how to manage it.
And what about the future?
Exactly. What's next for diabetes treatment in animals? Are there any exciting new developments that could lead to better treatments or even a cure?
There's some incredible research happening right now, and it's really promising for our pets. One of the most exciting areas is the development of new types of insulin.
So even better than what we have now.
Yes. Researchers are working on long-acting insulins. They can provide more stable blood sugar control with fewer injections. Imagine giving your pet insulin just once a week instead of every day.
Wow, that would be amazing. It'd be so much easier for owners and less stressful for the pets, too. What other breakthroughs are scientists working on? Another really exciting area is stem cell therapy. They're looking at using stem cells to actually regenerate those damaged islet cells in the pancreas.
So you could actually regrow the cells that produce insulin.
That's the idea. It's still early days, but the initial results are really encouraging. If it works, it could completely change how we treat diabetes, not just in pets, but in humans too.
It's amazing to think that we might be able to cure diabetes one day.
It is. And there are other promising approaches too, like gene therapy and immunotherapy. They're focused on fixing the underlying causes of diabetes rather than just treating the symptoms.
It sounds like the future of diabetes care is really bright. But even with all these potential breakthroughs, it's important to remember that the best way to help pets with diabetes right now is through early detection, careful management, and a strong partnership between owners and their vets.
I completely agree. The more owners know about diabetes, the better they can care for their pets.
Well said. And as we wrap up this deep dive, I want to thank you for sharing your expertise with us. I think we've all learned a lot.
It's been my pleasure.
And to everyone listening, I want to leave you with this thought. Knowing what you now know about diabetes in pets, what can you do to protect your furry friend? Pay attention to their eating habits, take them to the vet for regular checkups, and watch for any signs that something might be wrong. Your actions can make a real difference in their lives. Remember, you're their advocate and their best friend. So until next time, stay curious and keep those tails wagging.